Hello everyone, welcome to Heal Vayora Homeopathy Clinic. I'm Dr. Sonali Jha. Today we'll be talking about one of the most common hormonal disorders seen in daily practice, that is hypothyroidism. First, we'll understand what hypothyroidism is, how it is diagnosed, their causes and risk factors, and how homeopathy approaches its management with holistic and constitutional perspective. First, we'll talk about what hypothyroidism is. Hypothyroidism is one of the most common endocrine disorders encountered in daily practice. In India, a significant number of patients, especially women, presents with symptoms of hypothyroidism and many are already on levothyroxine therapy. This condition occurs when thyroid gland does not produce enough thyroid hormone, leading to slowing down of the body's metabolic processes. Now we'll talk about the causes of hypothyroidism, that is primary, secondary. In primary, there is autoimmune thyroiditis, iodine deficiency. Iatrogenic causes may we'll have thyroid surgery and radioactive iodine and neck radiation. Then we have drug induced, and the last one is congenital hypothyroidism. In secondary hypothyroidism, there is a disorder of pituitary gland in which it can be due to pituitary tumors, pituitary surgery or irradiation, or pituitary infarction. Next, other causes we have tertiary and transient functional causes. In tertiary, we have causes like tumors and trauma, which leads to low TRH. And then we have inflammatory or infiltrate diseases, which can be viral or post-viral inflammatory condition, which are usually self-limiting. And then we have functional causes, which is due to can be due to postpartum thyroiditis, that is temporary thyroid dysfunction after pregnancy, may progress from hyperthyroid phase to hypothyroid phase. We have subacute thyroiditis, which can be due to viral or post-viral inflammatory condition, usually self-limiting it is. And then we have excess iodine intake. It can be due to excess iodine intake also. Now we'll talk about the risk factors contributing to hypothyroidism. It mostly occurs in female. It can occur due to increasing age. There can be a family history of thyroid disorders. It can occur during pregnancy and postpartum period. And autoimmune disorders are there. And there is a iodine imbalance also. It can be a deficiency or excess. Now we'll talk about the symptoms of hypothyroidism, in which we have physical symptoms and mental and emotional symptoms. In physical symptoms, there is fatigue and weight gain, cold intolerance, dry skin and hair loss, constipation is there, puffy face and bradycardia. In mental and emotional symptoms, there is depression, indifference, slow. Now we'll talk about the diagnostic approach for hypothyroidism. The most important test for it is thyroid function test. In lab reports, we commonly see TSH levels above the normal range, T4 levels below normal, and in some cases, reduced T3 levels. These investigations help confirm the diagnosis and the monitor treatment response over time. Now we'll have the homeopathic basis of hypothyroidism. Homeopathy does not treat hypothyroidism as just hormonal imbalance. It views the patient as a whole, considering physical symptoms, emotional state, mental makeup, lifestyle, and constitutional tendencies. The aim is to address the underlying constitutional factors that predisposes a person to thyroid dysfunction rather than only suppressing the disease. In homeopathy, medicines are selected based on the individual symptoms, picture of the patient. Some commonly indicated remedies in hypothyroid states include calcarea carb for patients with fatigue, chilliness, and weight gain, sepia for hormonal imbalance with emotional indifference, lycopodium for digestive disturbances and bloating, natrum mur for depressive tendency and cold sensitivity, graphites for dry skin and sluggish metabolism, and thyroidinum is selected in cases with marked weakness and mental dullness. It is important to remember that these remedies are prescribed based on the person's totality of symptom, not merely the diagnosis. Remember, your healing begins with right consultation. For consultation and guidance under supervision, reach out to Heal Viora Homeopathic Clinic, DM for appointment.